taking care of self, talking about feminine health. Today we have Kyesha Wadlington. She is not only my cousin, but a fellow board member at Eva's home, and she's also a traveling nurse. She will be attending graduate school in the fall to pursue her doctorate in nursing. So I'll let her finish introducing herself. Hi, Kyesha.
Give me 1 second. I'm having some technical difficulties here. Can you guys see me? No.
No, I can't see you.
But I can hear you.
Okay. Oh gosh. Give me 1 second. So it says my camera's on, but okay. Let me try something. Let me try one more thing. This is what. Okay. Let's see. Okay, can you see me now? I can see myself. I don't know. No. Still not working.
Yeah, it's telling me your video's off.
And I can see me. Okay, give me 1 second.
Here it is.
Is it on now? Can you see me?
Well, it's coming on. There it is.
All right. It's my computer. Gosh. Oh. Okay. Now, how do I take off what you just
Boom. There you go.
Okay. Okay, now can everyone see me? It's probably not the best quality.
Yes.
Okay. So my name is Kyesha Wadlington. I am a registered nurse, or a pediatric registered nurse, and I travel all across the country to deliver care to children across the country. I'm originally from Chicago, and I don't really know what else to say other than I will be starting school in the fall for my doctorate of nursing practice. So just continuing to further my education and my career as a nurse and a medical professional here, in America. So without further ado, we're gonna go over the topic of feminine health and wellness. And I think that's what we're going for the topic of today. Am I correct?
Yes.
Okay. So it's not really a really long PowerPoint, but it is one that I like to tend to show my patients, typically my female patients, and within the range of preteen, adolescent to young adulthood. So Melanie, I'm not really sure. How old are you exactly?
I'm 15.
Okay. So some information you may already know and some new information you might learn today. But we're just gonna go over the topic of just feminine health and just kind of like the basics of why it's important and, how do we maintain a healthy feminine health and wellness overall as women, okay? I'm gonna share my screen here so I can go over the PowerPoint. Give me 1 second. Give me 1 second here. I feel like I don't know how to use use things anymore. Weird.
So
Okay.
See like the share screen at the bottom.
Yeah, no, I see that. I'm trying to make my PowerPoint bigger so I can. Yeah. This is weird. I feel like I don't know what I'm doing. Okay, give me 1 second. So let's see here. Now I feel like I lost you guys. Oh Lord. Okay, so this is, let's do here. Okay. And let's let's start. Okay, so can you guys see it?
Yes.
Okay, so like I said, so this is just an overview of feminine health and wellness, okay? And it's just giving you a general overview of why it's important as women that we keep ourselves healthy in all areas and aspects of life, okay? Let's do this. Okay, so just to pretty much start, this is just a slide that says like what is healthy, and everybody defines healthy as something different, but as women, or just people in general, but as women, your health is very much dependent upon your your own personal lifestyle and your personal choices that you make, also as well as some of the uncontrollable elements that we don't have control over, as far as genetics, our environmental conditions, our gender, ethnicity, our cultural issues, our age-specific risk factors, and potentials for different accidents. But overall, this is what would be defined as what a healthy individual would comprise of a healthy individual, okay? And so going along with that concept, we also like to preach something to our patients in the hospital as something as the whole person concept. And so when you look at an individual, it's not just the illness that they present with, or it's not just one problem about them, but we also just like to look at the individual as a whole. So that's looking at the elements about your, the important elements about the state of your well-being. So that's including your mind, which is your psyche. I don't know if you ever heard that word before. Your body, which is like your physical status, and then your spirit. So that's just kind of like how your philosophy about life, pretty much. So the mind, body, and spirit is what makes up a person as a whole, okay? And so that's going over that overall concept of being healthy and wellness. But for today's purposes, we're just gonna pretty much touch on what the physical, which is our body aspect of everything, okay? So the dimension of wellness. So wellness is also further categorized into 6 different subcategories. And so that's consisting of your physical, your social, your occupational, intellectual, your spiritual, and then your emotional. Again, these are just the different realms of what wellness is. So when I put together this PowerPoint, I like to believe that you can't talk about health without talking about wellness as well. So these are the reason why some of these slides are in here, just to go over a general overview of what wellness is for the entire person. Okay. Again, today we're only going to touch on our physical aspect of health and wellness. Okay. So when you're looking for overall health and wellness, I always like to tell people you always want to aim for what the healthiest version of yourself is. So some of those concepts are aiming for a healthy weight. So I know a lot of people, especially our young teenagers and preteens, they like to do like fad diets or like different things to try to like lose weight if they have like poor self-esteem issues or whatever that may look like. I know sometimes most teenagers struggle with anorexia or bulimic or eating disorders to try to get with this whatever idea of what they want their body to look like. But I always like to tell people to just aim for the most healthiest weight for yourself. Okay. And so what that includes is just always being physically active every single day. So whether that's getting up, walking, 15 to 30 minutes a day, running, or if you are any type of sports in school, that's also really good. But just making sure that you're physically active, raising that heart rate, because that's going to go for the most healthiest version of yourself. Okay. You also being a teenager, you also want to build a healthy diet. So you really want to start early because the older you get, it's harder to maintain certain healthier aspects about your life, especially as women, because our body is forever changing. So you want to build a healthy base by eating fewer calories. You want to choose a variety of the foods that you eat, which is like the fruits, your vegetables, your grains. And I'm sure you've heard most of this, all the time. But again, you can't talk about feminine health without talking about overall wellness as well. Okay. So I know we like to eat our fast foods and we love the quick on the go type of foods, but you always want to try to choose a diet that's like low in fat and cholesterol. Okay. Choose like the beverages and foods that are like low in sugar to moderate your sugar intake. So not a lot of juice, but you want to increase your water amount and not a lot of soda pop, but you want to start drinking juice or water in moderation, but you just want to try to do the things to decrease your sugar intake. And then you also want to start preparing your foods with less salt. This is also very important, especially for our African American women, because we are known to have genetic familial history of high blood pressure, hypertension, high cholesterol, diabetes. And a lot of these things come from high sodium or salt intake in our foods, or a lot of sugar intake in our food, which leads to different problems down the line. So these may not be problems that arise while you're a teenager, but they will start to show up later in life, especially as women. And then also, you don't drink alcohol. I hope you don't drink alcohol. But for most teenagers who, if they do, we always just have to tell them that obviously don't do it at all, but do it in moderation. If you do, don't out there, get wasted or anything like that, because those also have calories inside of the alcohol as well, which can further add to weight gain and hormones being out of whack and all type of things like that. So this next slide goes for something that's really important as far as our feminine health, and it's pelvic examinations. So usually, typically around when a woman, or I would say an adolescent or a young girl, starts her menstrual cycle, that's when her body starts to go through a bunch of changes. So she'll start to see body changes as far as like developing breasts, and you'll start to notice how you'll have like different moods just based off the hormones and different things like that when you are on your menstrual cycle. But one thing that is also very important to know is pelvic exams. So this is just pretty much what it is. It's like a visual screen to ensure that your reproductive organs are healthy. So it checks your ovaries, your cervix, your uterus, and just to make sure they're the right size, they're the right color, they're the right, they have all the right tissue, healthy tissue surrounding that area as well. And so I always like to tell this to young girls who are menstruating, who has started their menstrual period. In this slide, it says exams should be conducted annually, I'm only specifying that if you are sexually active. So if you are sexually active, you want to get a pap smear or a pap test done once a year, because then that also is going to ensure, again, the health of your uterus, your cervix, all of your reproductive organs as a woman. If you are not sexually active, it is not recommended. I mean, it is not like recommended that you get a pelvic exam, like a pap smear, because of the risk that of it hurting and it tearing your lining and things of that nature. However, you can still go to your pediatrician or your doctor, and they can do a pelvic exam just with their hands, just to, with their fingers, just to make sure that the lining and everything is still intact. So then also one of the things too, when we start menstruating as women, again, some people or some young girls start as early as 9 years old. And some people can start as late as 24 years old. So what we have been seeing in medicine and in science, the earlier that you start your menstrual cycle or your menstruation, the more likely it is for you to have some of these common disorders. So some of the menstrual disorders that girls typically tend to see later on down the line, or maybe, as they grow older, or their body starts to changes with the different hormones, they can experience something called endometriosis. And that's really what happens with endometriosis, is when the lining of the endometrium fragments, it starts to lodge in different parts of the body and causing an ailment. It's very painful, and this is something that could be requires medical attention, and it can potentially turn into endometrium cancer. So that's back to those pelvic exams. That's really important, why you get those exams, to make sure you're screening for different disorders as such. Another one is dysmenorrhea. And so what that pretty much means is you just having very painful cramps. Have you ever just had really painful menstrual cramps and you're just like, oh my God, I don't know what to do. And you're debilitated and you're staying in bed all day, or you don't want to go to school? I know I have. So the name for that is called dysmenorrhea, when you're having really painful cramps. Another one is called amenorrhea, and that pretty much just means you're not having a period at all. So what we see with a lot of young girls, they may have started their menstrual cycle, and they may be irregular for whatever reason. So they'll start, but then they won't get one for 2 to 3 months, or they won't get one for however many months at a time, and then they'll start to get one again. So that is called amenorrhea, and that is also just a disorder, because that is a way of your body telling you that something is wrong, or it's a further issue. Another one that is really common in our young teenagers, that can start as early as teenage years, is something called polycystic ovarian syndrome, also known as PCOS. And what happens is, as our body begins to change, our hormones are now starting to change as well. So the woman body starts to create excessive amount of male hormones, something called testosterone. And because our body is not able to handle male hormones, because we were not meant to be, males, what happens is it starts to create small cysts on our ovaries, and sometimes those cysts can be very painful. It can start to rupture, and you can just have like a lot of abdominal pain. So this is also something that you want to go to the doctor and go to your gynecologist if you are experiencing any of these. You want to speak with your doctor or your pediatrician, your gynecologist, just to do one of those pelvic exam, those wellness checks to make sure that everything is healthy and intact. Okay.
So is there anything that like specifically causes some of these things? Because I know, like, I remember back in school, like they did all of those 2 days of like separating girls and boys, and I remember like them talking for a short period about how like not eating and stuff can like stop your period. So like I know when you said amenorrhea, I've never heard of that specific name, but like I know that was something like I had heard about. So is there anything that like you are doing or may be doing like that?
So not necessarily. Everybody's body is different. It could be something like, so for instance, if you're having like an absence of a menstrual cycle, right? So you might have started your period and then you didn't have one. Again, that could be your body's way of telling you that something is wrong. It could be like one of those pre-perceived, like it comes before the actual diagnosis or something. So it's just like a warning sign almost. Sometimes girls who do have amenorrhea, obviously, a couple things. You can have that when obviously you're pregnant. You don't get a menstrual cycle when you're pregnant. So that could be reason one. One reason. Another reason too is not really with the food you eat, but sometimes stress can cause a lot of our menstrual disorders as well. So that's also going back to that overall wellness concept of how everything is composed of your mind, body, and spirit. You want to make sure that all of those things are intact, because everything, it's like a domino effect. Everything affects something else. So when you're not well and healthy in other areas and categories of your life, it'll start to show up in your feminine health. And again, it's just our body's way of telling us, hey, something's wrong. And it's pretty cool that we get to know those, signs that our body is telling us that something's wrong or that we might have another issue at hand. But it's not necessarily something that the girls could be doing. Again, back to the first slide, when I mentioned it could just be genetics, it can be our ethnicity, it could be our any pre-linked, disclosure, cultural issues. It could be a lot of different things as to why most women get certain menstrual disorders. So it's not one set category. And again, everybody's body is different. So there's really no real explanation as to why, but that was a good question though.
Thank you. We also like talked about mental health and self-care in our other two taking care of self classes.
Mm-hmm.
So is that like something, do you think, like, because I know when we talked about self-care, we talked about, taking some time out to really just make sure you check in with your body. Do you think
Mm-hmm.
that could also help with like some of these menstrual disorders, especially when you say like stress can cause?
Yes. Mm-hmm. A lot of these things can help. So I know if you guys said you talked about mental health, that's really big, because it's really important that you want to keep balance. Okay, I know we have so much going on, and just recently with the pandemic and being locked in the house and everything, you want to make sure that you're taking time out to nurture your mind. So the thoughts that you put inside of your mind, all of that is encompassing of everything. So what it is like your brain is like a center of signals, and it just signals throughout your body. So whatever you're feeding your brain, if it's constant stress and it's under constant attack, then your other organs is not going to be able to function, including your reproductive organs as women. So you have a lot, it's really a lot to think about. It seems so complex, but it's also so simple as well. I mean, it could be something as simple as like doing yoga, doing meditation. And this also links back to the physical activity. The more that you are physically active, um, the more that you are telling your brain like, hey, I am in a different state, of mind. And so therefore you are feeding, you basically are telling your brain like, hey, send blood to my different organs, vitalize these organs, make sure they're working properly. When you're not doing those things and not taking care of that, mental aspect, then the brain won't do it for you. You have to tell it to do it. You have to almost like train your mind to be in I guess, a state of balance or wellness. So it is really, really important, but it's also very hard to miss as well, because we get so caught up in our day-to-day life. And sometimes, especially as women, we forget to take time for ourselves because I think our nurturing attitude, naturally, our nurturing attitude is so concerned about everybody else or everything else around us that we forget to take time for ourselves. And that can be very detrimental to our health as well. So just don't forget to keep that in the back of your mind while you're thinking about, certain things, especially eating healthy, physically fit, just doing, even if it's 15 minutes of meditation, yoga, journaling is a really, I know that's become really popular, especially amongst teenagers. Another one is that I see a lot of my female patients do, or teenage patients do. They like to, color, like adult color. They have these like adult coloring books.
Oh my God, those are so frustrating to me, but a lot of people
I
find
love
them
them.
very
Yeah. So that's a stress reliever for a lot of people, because it requires you to think, and then you can create something and you feel, like our brain, when they see colors, it reacts differently. It goes really deep. It gets really, really deep. I mean, we can talk about it all day as far as like mental health and mental aspects of everything. But when your mind is not well taken care of, everything your body will tell you for sure. And it'll show up in different disorders such as this, which leads us to our next slide. Some other medical concerns of, women who are menstruating could be uterine fibroids. The next one is a hysterectomy, and that's typically for women who had their ovaries and uterus and everything removed. So that's what that means, a hysterectomy. Everything, all of their reproductive organs removed. However, this causes a concern because everything works together as one in our body. And if you remember that, then nothing is supposed to be eliminated, right? So a hysterectomy, when you're removing everything from the body, when you're removing all of the reproductive organs from the body, now your body is like, okay, I'm missing something. So something else is going to try to compensate. And so what typically tries to compensate is our hormones, because as women, we have female hormones or something called, estrogen. So when we take away those parts, then now we are running a risk of cancer. We're running a risk of other disorders that, we wouldn't naturally be prone to had we not removed our reproductive organs. So as much as they can cause like trouble, they also are very good for women because, again, we are, natural life givers of this earth. So this kind of almost like what we were placed on the earth to do was to reproduce with our female organs and reproductive system. So
why do women get hysterectomies? Because I know a couple of people who do get them, but like I'm not sure like what's the whole purpose. Because I know you like can tie your tubes and stuff like that.
So most people get the hysterectomy, like they tend to do it so after they have babies. So most women, they'll have maybe, a couple children, they say, hey, I'm done. I don't want any more children, so you can take all of this out, right? Some women do it because they don't ever want to have a period ever again, right? So then they go and have a hysterectomy and they take all of the female organs out, and you won't have a period. And some women do it actually because if you have another medical illness or condition such as like cancer or anything that may require you to remove your uterus, your ovaries and fallopian tubes, all those things, then they'll go and do a hysterectomy to save your life. So again, while they are important, some women do it electively, meaning like they chose to take all of it out. But what happens is they create a problem for themselves in the long run, whether you've done it, whether you chose to get it done or whether you had to have it done for any other type of ailment. In the long run, you are disrupting almost like your cycle, like of life almost. Because as women, we start at menstruation, and then you go through premenopause, and then you go through menopause. So all of those things are important for the like circle of life, like the cycle of a female's life. However, when you remove those organs, especially at an early age, and you don't get to go through menopause, now again, you're creating more trouble for yourself in the long run, and you're prone to more cancers, a lot more cancers for sure, and more infections and things like that. So it's just, again, based off of preference, why some women decide to remove their reproductive organs, and also it could be based off if it was to, if the risks if the benefits outweigh the risk as far as like removing it if you had like some sort of cancer or something like that. But again, our female anatomy and our reproductive organs are very, very, very important. So that's why it's very important to take care of them. And then the last one I wanted to talk about was toxic shock syndrome. Melanie, have you ever heard of that?
Yes.
Okay, so this is going to lead us into our next slide, which goes into the actual feminine hygiene and the feminine, ways to keep our vaginal health healthy and things like that. So the toxic shock syndrome, I've actually taken care of a few young girls with this. And so it's really important, again, to change your tampons, change your pads when you're on your menstrual cycle and all these things, because you can develop toxic shock syndrome and you can actually die from it if it gets really bad, because then your body goes into something called septic shock, and it's fatal, so you can die. So it's one of the things we want to avoid too. Okay. So, and this leads us into our next slide, so which is going to talk about the feminine hygiene. So I just kind of went over the overview of like a general overview of what wellness looks like. So now we're going to get into the actual hygiene part of females. So it is very important to keep the vaginal area clean and healthy. And I'm sure you've heard this numerous times, but I am going to reiterate it for the sake of this PowerPoint. So yeah, this is called feminine hygiene, and it's, again, keeping our vaginal area very clean and how to keep it healthy, okay? So we're gonna go over just like the different things you may see and experience when you talk about your vagina. I know that, especially in our culture or day and age now, I always like to ask young girls, what do they refer to their female anatomy as? And then I also like to educate them on what the proper scientific or medical terminology for those anatomies are. So I am going to ask you a question. It might get a little personal, but how do you refer to your lady parts? Like, what do you say?
I'll start this part out. Melody, I know we are recording, so I will edit this part out for you.
I
Okay.
know it's recording, but keep
I say my coochie or my pom pom.
Okay. I know, especially like in our culture, we are our parents or whoever, teach us different words to refer to our female anatomy. But I always like to I see a lot of young girls who come in and like, vagina, that is a weird word and it doesn't sound right. And I say, no, it is what the correct terminology is, but it's okay if you refer to it as something else, because what ends up happening is I again educate them on what the correct word is, but you always want young females or young women to feel comfortable with their own body. So whatever they refer or whatever you refer to your female anatomy is, if that's what you feel the most comfortable with, stick with it, do so, because then also in that comfortability, you start to feel empowered as a woman. Yeah, you'll learn that later on, like when you get older, like maybe 20s and late 20s, you'll start to feel empowered and you'll keep that near and dear, and then you'll start to treat your vagina as if it is a very precious member of society, truly. So that's totally okay. I just always like to ask. But so going into the some of the things that we experience with our vagina is something we call discharge. Now, I know that a lot of young girls think that discharge is abnormal, and it is not. So after our bodies go through puberty, all of our natural hormones in our body causes an increase in vaginal discharge. And this is something that is totally normal, because what discharge essentially is made to do was to help protect our body. So it's almost like a protecting agent from any type of outside foreigner. Okay, so discharge is normal. Some discharge is normal, but a buildup of too much vaginal discharge can cause rashes, irritation, odor. I'm sure you've heard of like yeast infections, or something called bacterial vaginosis, which is BV. And you can have like this fishy odor. Some STDs or STIs can cause any bad, call it bad discharge is what I'm going to call it. But a good discharge, and what an indication of like a normal discharge is if it's almost like snot. Have you ever seen like snot come out your nose, and how the mucus is like thick, and you can kind of, I don't know if you ever touched snot before, but it's thick and it's like it's elastic, it's sticky, it's clear, it's not cloudy, it's not white, and it doesn't have a smell to it. So those are some indications of what a normal discharge is, okay? And it's okay to have some in your underwear every day, because that's just what our bodies are made to do.
So can you talk about the different colors? Because to be honest, I know grown women who still struggle with that, because it's like 15 million different colors, and it's
Yeah.
it ain't never gonna be like straight clear. So
No.
what is this?
Everybody is different. I mean, I'm going from the sake of woman who is straight out of puberty, who may not be sexually active. So if you are not sexually active and you are on your menstruals and you have started your menstrual cycle, you'll see like a clear, thick mucusy. That's what I'm referring to. Now, when you begin to become sexually active, that's when your discharge starts to change. So for women who are sexually active, you can see what's considered normal almost is like it's like white, but it's not cloudy, if that makes sense. So like a whitish discharge, but it doesn't have a smell to it. It's not like clumpy or lumpy, it's just kind of like a smooth consistency. Those are all still considered normal. Now, when you're getting into like the yellow, green, any like discoloration other than like clear and white, if you're getting into any of those colors, then that indicates that you have another issue going on. More than likely a STD or STI, left untreated, and you didn't know. But again, everybody's body is different. So you have to go according to obviously what your body, is. So you can't compare, like apples to apples, oranges to oranges when it comes to women's vaginal, I guess, parts. But this is also why it's important why you have to like learn your body. So it's okay to explore. I always like to tell my young girls to explore if you don't know. Like if you see the discharge in your underwear and you're unsure, grab a piece of tissue, pick it up, touch it, smell it, so you know what is normal. So therefore, when something abnormal happens, you're like, okay, this is totally out of whack from what I saw the first time. So it's okay to explore and to figure out what's your normal, okay? So it really just depends. Every woman is different. But if they are starting to see like I said, discoloration, like any type of colors, or it's a fishy odor, irritation, itchiness, then they need to seek medical attention soon. So that could be a problem. So again, the amount of discharge, this is also very important. It can change from different things. So we all know that discharge is normal, but the amount is important too. So when you're on your menstrual cycle, on your period, you can have minimal discharge, obviously, because you're seeing blood, right? So you can have minimal discharge. It still will be some there, but it'll be super minimal. Now, also based off sexual activity, which is what I mentioned before. Now, if you're having like excessive amount of discharge, say, like you're sexually active, and you're having an excessive amount, meaning like your underwear, it's always damp or moist within like an hour, and you're constantly like, man, I feel moist, damp, that indicates an issue as well. You need to see a specialist or see a doctor. Also, some type of birth controls actually can throw off our discharge as well, and could create more or less amount, because there also are some birth controls that stop periods as well, or stop menstrual cycles as well. So you want to make sure again that you know what your normal is, and then so you can know what's abnormal. Exercise, although it's very important, sometimes it can, cause excessive discharge, because our body is now, expelling out any toxins or any waste that we may have in our body. And that's another way for it to come out, is through our vaginal discharge as well. Our hormones, because we have so many hormones in our body, they can become irregular, or they could decide not to regulate one day, and that can cause excessive amount of discharge as well. And then lastly, what I hit on earlier was the different type of infection. So you can have a sexually transmitted infection, you can have a yeast infection, and those can also throw off our vaginal discharge. So again, it is very important. If I don't reiterate this again, it is very important to know what your normal is, so you can recognize what abnormal is for you, okay? So then our next slide goes into maintaining a healthy vagina. And this is just basically like some do's and don'ts of how to just maintain a healthy vagina. So before I go into this, Melanie, have you heard of like a pH balance in your vagina?
Yes.
Okay, so that's also very important too. Before I talk about this, it's really important to maintain your pH. Obviously, you don't want to be too acidic, because then that's how infections or different diseases thrive in acidic or acidic environments. And then neutral, I mean, you don't want to be too neutral either, because then you throw off your normal flora. But so you just want to maintain the healthy right amount of balance. So goes back to that overall wellness, how you always want to be in balance at all times. So it literally affects everything in our body. So some of the do's of maintaining a healthy vagina, you want to take a shower or a bath every day. Despite what you heard, even if you heard don't take a bath every day, if you have started your menstrual period, it is very important to shower or bathe every day, because our buildup can cause our buildup like of our body, or like our sweat, and just everything that we experience throughout the day. It can build up and it can actually travel inside of our vagina from the outside. So it is important to just wash off everything from the day. And when you're washing in the shower, you want to use gentle unscented soaps. So I know we love our Bath and Body Works. I know we love our Victoria's Secret and all of our smell goods. That is okay for the body, but it is not okay for your vaginal area, okay? Also, another thing I don't have on here, but you want to make sure you separate your towels. If you're using a towel or a loofah, whatever, you want to separate. Do not use the same towel for your body and your, when you're washing your vagina as for your face. So you always want to separate your towels. And I know a lot of people don't say that. They'll probably like use the same towel for both, but that is not okay. You want to separate it because you don't want to cross, contaminate. Okay. So when you are washing, unscented soap, my favorite is Dove. Dove has like the most mild scent. It's unscented, obviously, but if you use most Dove soaps, they are very mild. I know some people use like Caress or Cetaphil, and for women who have sensitive skin, obviously, they find like what works for them. As far as like, I know some women who do like African soap, African black soap for their skin and stuff like that. But whatever it may be, just make sure it doesn't have any perfume scent in it, okay?
Talking about soap, can we like do a small PSA about apple cider vinegar? Because like the big thing about these sessions, and especially putting them on YouTube, is so people can get this information. And I've been hearing like a lot of weird stuff. Like, I know when I was a kid, douching was big and they told us not to douche, but like it seems like it's coming back around, but with apple cider vinegar. And I'm just like, oh God, please don't do that. So yeah.
So what apple cider vinegar does is what, like the research that's out there now, is not much research about the apple cider vinegar. Is one of those like, what do you call it? Like life hacks that people discovered, that they're saying like it works. Again, everybody's body is different. So what works for one person may not work for the next person. So that goes back to, do not try to go into these fad phases or diets or different things that you see on the internet. Again, what works for one person may not work for the next person. However, most women tend to put a spoonful or a capful of apple cider vinegar in their bath water when they're bathing or soaking. The science behind it is, or the thought process behind it is, it's going to neutralize your pH balance, basically. So say for instance, you have a very maybe acidic pH or something like that. Or say if you're having a yeast, I'm just going to go with the example of a yeast infection. So say you have a yeast infection, right? And you sit in the tub and you're trying to alleviate the itching, or you're trying to alleviate the pain that associates with it. So they sit in the tub, they'll put the apple cider vinegar in it. Because the vinegar or is pretty acidic in nature, what it does is supposed to soothe the area by basically killing off the bacteria that's around or surrounding your vagina. So that is the science or the thought process behind it. Again, I don't know women who actually like douche with it because you're not supposed to, but I do know women who do put it in their bath water. Some people use it for spiritual rituals. If you're into spirituality and different doing like healing baths and things like that, I do know some women who use apple cider vinegar for their spirituality. You know, they say it brings them closer, you know, to whatever in their spiritual journey. So it's different reasonings behind why women do it. However, it is no research or no science to support the actual nature of what it could be used for. But apple cider vinegar is also a natural product, like it's natural and it comes from like earth. So it will be no doubt in my mind that it could be used for a variety of many different things within our body. Because what it does is it's probably going to turn our body back into a normal balance. Again, it's just no science behind it to prove it. However, if those are some of the things that you are into as far as like natural medicine or naturopathy medicine, or holistic approaches to maintaining like feminine health or a healthy, balanced lifestyle, then I mean, I encourage to look into it. But again, what works for one person may not work for the next person. So you have to be super careful.
You should not douche or just,
no. And that's what I'm gonna say.
I don't mind you using it because I use it in my hair sometimes, but
Mm-hmm.
I think the biggest thing is people.
I mean, sometimes like you shouldn't douche, but I mean, sometimes I take apple cider vinegar. I just take a shot of it a day, like, you know.
Me too. But when putting it on your body, since it is acidic, you have to
you have to be really careful, especially around your vagina, because what a lot of women tend to forget is that our vagina is self-cleansing and is self-healing. So all of the things like the discharge, our pH balance, and all of those things are set in place naturally to basically disinfect our body, disinfect our inside. So it is like, I like to say disinfect, but it's really what it is. It's just cleansing our feminine womb. It's cleansing our womb. So when you start to interrupt that, then now you're creating more of a problem. And then you're more prone to infections or diseases. So it's just really important to just be cognizant of what you're putting down there, which is why, like I said, don't use any heavy perfumes or, things like that. Also too, when you get out of the tub, you want to pat dry. Don't rub your vagina, don't rub your vaginal area. It can cause irritation. And then also too, before you can get dressed, it can cause like mini cuts and everything in your vaginal wall, and that hurts, and you do not want that. It is also very important. Again, I know we love our Victoria's Secret panties. We love our cute, lace panties and boy shorts and cheekies. Those are cute. However, they are not healthy for us. When we're talking about like our vagina, and when I go back to when I say like you're gonna treat her like a precious gem, the older you get in life, you want to start wearing underwear with cotton. Okay, so cotton lining. Walmart got Hanes and Fruit of the Looms. Love them. Okay. It's okay to wear the Victoria's Secret ones, but make sure you are alternating with cotton, pure all white cotton underwear, because what it's doing is giving your vagina a chance to breathe, and it's not being so constricted. And you want to make sure you're changing your underwear daily, okay? So don't leave it on for extended period of time. Also, you want to wear loose and comfortable clothing. So again, we love our short shorts, we love our skirts, we love our leggings, but it is important that we wear loose, comfortable clothing because again, it's giving our vagina a chance to breathe while we're outside, while we're walking, and doing like physical exercise and things like that, or as we go throughout our day. And then it says, do not wear pants without underwear. That can be very dangerous because of the dye that's in the jeans or the dye that's in the pants from when they make the clothing. That dye or that coloring or whatever can actually get inside of our vaginal opening and create an issue. So you always want to wear underwear when you're wearing jeans or pants. And then it says avoid tight clothing, so leggings, leotards, tight pants, things of those nature. And then when you're going to the bathroom, I know you heard this a lot, Melanie, but when you go into the bathroom, you always want to wipe front to back, okay? So you always want to take the tissue and go from your vagina down to your anus, okay? And that is because you want to, you can potentially if you don't do that, you could potentially put yourself at risk for a UTI, which is also very common in women. So are you familiar with what a UTI is?
Yes.
Yeah, so it's very common, but it's important to just wipe front to back all the time. You don't want a urinary tract infection. Because our vaginal open is so close to our anus, it's important that we just try to remember, certain things like that, okay? And then also, if you are sexually active, always urinate before and after intercourse. This is very important, and a lot of women, even older women, forget this to this day. And they create so many issues for themselves or they wonder why they are experiencing BV or reoccurring infections. Is because they're not urinating. Again, because our female anatomy is so close, so our vagina or our vaginal opening is so close to our anus, and then also inside, we're not emptying our bladder. If you have something constantly penetrating that area, then you can cause like a bladder infection. You can cause a UTI. It's so many different things. And our reproductive organs, again, are important, but they are very sensitive as well. So it's very important that you take care of those as well. Something so simple as urinating before and after sex. And then it also says drink a lot of water. So drink water before and after sex if needed. And then for washing, it says use your fingertips for washing. So you can take your towel and just kind of like wipe around the vaginal opening. Don't stick the towel inside of the vaginal canal. I see a lot of girls do that for whatever reason. They think it's going to get cleaner, but that's not true. Just you want to take the towel and wipe around the vaginal opening with warm water and unscented soap, okay? Now, continuing with maintaining a healthy vagina, these are some of the things you do not. So this goes back to Erin's point when she said the douching. So douching is not recommended. Melanie, do you know what douching is?
Yes.
Okay. So douching is not recommended at all. What you're doing is when you're putting something up there, again, you're throwing off your pH balance and you're telling your body, hey, I have something else in here. And your body's like, no, but I'm trying to do my thing and you're trying to interrupt me. So do not douche. Don't use any powders. I don't know if you guys heard that Johnson & Johnson is now being sued, the company, for baby powder. It is now being sued in a class action lawsuit for women who was using baby powder in their vagina area to try to keep dry from the moist, right? And now the powder has caused cancer, endometrial cancer. So again, don't use any powders down in that area. Do not use any sprays or deodorant, any scented products, meaning like any of your perfumes. Again, our vagina is self-cleansing, okay? It does all of the work on its own. It does not need our help, okay? Again, some odor is normal. So this is back to know what your normal is so you can understand what abnormal is, okay? And then most young girls are under the impression that scented perfumes will remove or cover the odor. It won't. You can spray it and 5 minutes later, you're still gonna smell like this odor if you have this odor. And if you have odor, it is very important to go to your doctor and get it checked out, okay? Because that can be an underlying issue of something else. Again, these products can hurt your body's natural barriers. It can increase your risk for a vaginal infection, and it also can cause allergic reactions, which can be fatal as well. So you just want to be really careful. Again, do not use bubble baths. I know we like to take our baths, and I know for me especially, this was also very hard for me, and I'm just being very transparent. I used to love sitting in bubble bath and like light candles. I thought that was my way of like meditating and being one with myself, right? And then someone told me like, why are you putting bubble bath in your bath? And I was like, oh, like it makes me feel like I used to like to play in the bubbles. They're like, no, this is not it's not good for you. Again, most bubbles bath have scents in them. And so when you're submerging your body into a tub of water and you're just surrounded in this scent, because when those bubbles go away, now you just have that perfume just sitting in the water. So again, that goes back to no deodorants or no scented products around the vaginal area. So if you are going to sit in a tub of water and bathe and soak, I would suggest you do it with some natural oils. I know some people put peppermint oil. I know some people put lavender oil. Epsom salt is okay if you're trying to soak in Epsom salt, but no, like, again, perfume, scented, any like natural oils is okay. Don't sit around in wet clothes or swimsuits. So if you're coming from the swimming pool or the beach, or if you are working out and you decide to sit in your sweaty clothes, that can also cause a yeast infection. So that moisture is going to build up and create a warm environment, and then yeast is going to start to form. So you don't want to do that. Also, you don't want to wear panty liners daily. Despite to the contrary belief, most women do wear panty liners because they feel like their discharge is just so excessive. They don't want to feel it, or they don't want their underwear to get messed up, so they'll wear a panty liner. However, what the panty liner does is absorbing that discharge that is supposed to naturally expel out of your body, and it's absorbing it and it's re-entering your vagina because it's sitting in this panty liner. So, and your vagina is sitting on top of the panty liner. So you don't want to reintroduce that back into your body. So don't wear panty liners daily. And then also, do not use scented detergents. I know if you are in a household, this can be very hard for young girls who are in a household with a lot of people, and maybe you guys wash your clothes together or whatever. I know that was a big thing when I was growing up. It was a lot of us, so we all had to wash our clothes together. And so it was one laundry detergent. That was it. So everybody's clothes got washed in the same thing. But it is very important to not use like scented laundry detergent on your underwear. Again, because those things that they can linger, that scent or that perfume can linger, and then again create more of an issue. So you just want to be sure to wash. You can wash it, but I would say just wash it in very warm, hot water, mild scented detergent, and go from there. Okay. So those are some of the things that you don't do, just kind of to maintain a healthy vagina. And then to finish up with the maintaining a healthy vagina, we're going to go over just the feminine products. So I know we talked we talked briefly about the toxic shock syndrome. So this goes into the tampons and the pads, meaning like to change out your tampons and your pads. They should only be worn when you have a period. They absorb our normal discharge and our menstrual blood. So you don't want to sit in it for long because again, you're going to reintroduce blood and discharge back into your body that was meant to originally expel out of your body. Using mini pads or panty liners other times can cause the body to make too much discharge to try to protect itself. So when you do that, and you're wearing these panty liners or these pads, your body thinking that, hey, oh man, I'm on my period. Like it's crazy that our body is like telling us like, I think I'm supposed to be on my period or something's must be going wrong. So it'll start to create more discharge because it's thinking that it needs to protect itself. Like I said, our vagina is self-cleansing, it's self-healing. It's a natural defense. Discharge is a natural defense for our vagina. And then again, by wearing the tampons and the pad, it takes away from the body's natural protection against infection and odors and things like that. So if you're wearing those things and you do have an infection or odor and you're wearing them, you're not able to recognize what the odor is or the infection is because you're constantly in the pads or the tampons and things like that. So give yourself a break and only wear it when you have a period. And this is a big one. I decided to put this one in here because I get this a lot from young teenagers, specifically because this is during the time where your body is changing. So now you're starting to get breasts, you're starting to get pubic hair, you're starting to get, hair under your underarms. And as women, or teenagers in general, but women, we love our appearance, right? So a lot of girls come and ask me, what do I think about shaving? So some women do choose to shave around the vaginal area, and it's not a bad thing. However, shaving puts you more at risk for developing a skin infection if you do shave, because you can go in the wrong direction. You can do anything to irritate that skin. And because again, our vagina is very sensitive, even the skin around it is very sensitive. So you want to be very, very careful when you're shaving that area, okay? And if you do shave, you want to make sure you use a good quality razor, not a messed up one. You either want to change the razor out as often as possible, or change the blade on the razor if it's not disposable, if it's not a disposable razor. But most razors now are disposable, one-time use, maybe 2 times. But you always want to throw them away and get a new one if you are shaving in your vaginal area. And before you shave, a lot of things too, a lot of girls ask me, is it okay to dry shave? It is not okay to dry shave. You want to make sure that that area is wet and moist before you start putting a blade on that area, okay? Because essentially what you're doing is just cutting that area. So it would hurt if you just cut something that was dry, right? So you want to soak it in warm water or take a shower. Most people usually, shave in the shower is what we usually see. So this is easier for the hair to come off and then to soften the cuticles around that skin and make it easier for it to come off. Now, you can use shaving cream. They do have those options out there, but just be careful because a lot of shaving creams are not suitable for the vaginal. It's suitable for the bikini area, which is around like the legs, but not the vaginal area. So you just want to be very mindful. If you're picking up shaving cream, you want to pick up the ones that is actually for vaginal hair, okay? But shaving cream does prevent cuts and razor burns and ingrown hairs. And then of course, when you're shaving, just go in a downward motion. Do not do like some people go across. That's not right. You just want to go down. And then when you go down, you just do it once, don't go back up, because then now you're going to create an ingrown hair because you just disrupted the flow of the hair pattern. So it's really important. I personally do not recommend shaving your vaginal area if you do want the hair removed. And this may be something where you get older. I don't know if you get waxed yet or not, but I personally recommending like a wax, a sugary wax. It's easier to take off. It's less harsh on the body, and it can give you like better results as far as like no ingrown hairs and things like that. And it's more natural than the shaving cream and the hair removal cream. I even know some girls who put Nair down there, and you're not supposed to do that. Please do not use Nair on your vagina area. You can use it on your bikini area, you can use it on your legs, but not on your vaginal opening in your vagina. It will burn you. It will burn you.
To say that because like waxing, I know is expensive, especially for teenage girls. And
yeah,
like sometimes shaving is really uncomfortable because I know it causes ingrown hairs. So I do know some teenagers who use Nair. Like as a teenager, I tried that once, and I think that by itself taught me never to do it again.
Okay.
Doctor to tell me that.
I was just about to say, most girls who do try using hair removal cream, Nair, which is the one that's the most popular out there, they will quickly realize why it say do not put it on your vagina.
Yes.
It will burn.
Yeah, I definitely was a teenager, and I used it for my legs, and I like found it in my mom's closet, and was like, oh, this should work because it works on my legs.
The hair on our legs is not the same type of hair on our vagina. And also too, it's very important to mention too, like people don't believe this, but the hair on the pubic hair that's on our vagina as women is also used as a protection as well. Everything about our vagina is protecting us. So it's so hard to believe and weird to say it, but that pubic hair is actually protecting. It acts as a barrier actually from foreign outsiders from entering. That's pretty much in layman terms, that's what it is. So when you're taking all the hair off, now you just expose yourself or just put yourself at risk for infection, for anything, so just be mindful if you do shave or things like that. Just be super mindful of how much you're taking off, or don't do it as often. Let it grow out, especially as a teenager. I mean, again, if it's not something that's requiring you to shave, I don't recommend it at all to my teenagers at all. But again, we can only educate you guys. We can't tell you guys what to do, but we can only give you the knowledge that we have and educate you. But I don't recommend it. Let's go. Let's see what else we have here. Okay, so now we're gonna kind of we're gonna switch gears a little bit. So that was just pretty much talking about those were a little more like lighter terms. And then for the sake of this PowerPoint, I did not include any graphic pictures. So we will not go over any very graphic things. I removed all of those. But so we're gonna switch gears here, and we're gonna just pretty much talk about our sexual health, because this is also very encompassing of female and feminine health and wellness as well. So I know this slide, people, I'm just going to put it out there, women as early as whenever they're able to have a menstrual period. So I've seen girls as early as 9 years old having sex. Okay. So the age changes, yearly. I mean, it's just different. It could be cultural, it could be generational, ethnicity. It's just different things. But I've seen girls as early as 9 starting to have sex. So it's important to have this topic on sexual health. So if you are sexually active, we always tell people it could be a really, really great thing for people who are sexually active, right? But it also comes with a lot of consequences if you are not careful and if you are not protecting yourself, okay? So having sex can spread STDs and STIs, and it can lead to pregnancy. And Melanie, I'm going to ask you this question. I know you've heard of a STD before, right?
Yes.
And so do you know what the alternative for, do you know what STI stands for?
Sexually transmitted infection.
Okay. So we sometimes in our medical world, we like to use them interchangeably, but it's not. So sexually transmitted disease and a sexually transmitted infection are now classified as two different things. So essentially the disease is something that you can really get rid of, right? And then the infection is something that you can is sexually transmitted, but it's something that you can clear up with medicine. Okay, so I just like to put that out there to put them in separate categories, but we do sometimes use them interchangeably. Okay, so having sex obviously can lead to spread of STDs, and it can lead to pregnancy. So again, it is very, very, very important to protect yourself at all times. Okay. Sexually transmitted diseases or sexually transmitted infections. Anybody who is now having sex, or they can be at risk or can be exposed to an STD or an STI. Okay. STIs can be spread through oral sex, anal sex, vaginal sex, and what people also don't realize either, but any type of skin to skin, like genital touching. So even if that means that you are dry humping someone, you can get an infection if your genital is touching that person's genital. So you didn't even maybe have to have like vaginal, like intercourse, or the penis may not even been inside of the vagina or whatever, but if you're like on top of them and grinding and your vagina has touched the skin of the penis, or even the outside of his pubic hair or whatever, or even if it's with another female, you can also get an infection that way as well. So just be mindful. Also, most STIs and STDs can spread through body fluids. So like your semen and your vaginal fluids. So semen for males, obviously, and then your vaginal fluids for females. So that's how most STIs are spread throughout the body, okay? And then, which is gonna blow a lot of people, a lot of STIs are, I put super common, but when I say super common, meaning like every day someone's gonna have a sexually transmitted infection. Most women will at least get one sexually transmitted infection at some point in their life. And I say that because, again, our vaginas are so sensitive and it's so prone to so many different things that if our natural barrier or our natural body's protection is, at risk, then we are prone to a STI. So it is very common. I just want to debunk the stigma around STDs and STIs, because some people may think like, oh, I'm dirty because I have this. It's not true. It's common now. But it is also ways to protect yourself against it as well. Okay.
So can we talk about the STDs that you get from saliva? Because at that point, you don't even got to have sex. And no type of sex, no dry humping, no nothing.
So again, STIs can be spread through oral sex as well.
Oh, well, I'm talking about kissing. Because there's some, I learned like as an
oral. Well, I say oral sex, but oral also is encompassing of kissing too, because you can, so you can get something called mononucleosis, which is, have you ever heard mono?
Oh yeah.
It's mono.
You heard of mono, Melody?
So that
Yeah.
is it's not a like sexually transmitted. We sometimes don't classify it as sexually transmitted. However, it is a illness, infection, or disease that you can catch by kissing someone. And so what happens is your saliva in your mouth, again, your body's normal flora is not always the next person's body's normal flora. So when you're mixing, saliva and things of that nature, then you can get something called, mono. Also, too, a lot of girls who get oral, they can get herpes in the mouth orally, and that could be because of, well, that's more from the oral sex. Like you are, performing oral sex on a male, and he may not have any symptoms or anything, showing. You may not see no lesions or anything, but he is still able to spread this disease or this infection to you via mouth. So again, it is very important. And when I say woman, or you have to protect yourself and just be super, super mindful, a lot of the sexually transmitted diseases and sexually transmitted infections that women go through, or so men may have the same diseases and infection, but it does not show up symptoms wise. It does not show up the same. So women are different than men. Most diseases that women get, actually sexually transmitted, actually come from men. And what's surprising is some things are a part of their normal flora, meaning that it will never affect them. However, when it's introduced to our body, because it's a foreign bacteria and it's not a part of our normal body's natural defense, then that's how we get the infection. One in particular is something called Trichomonas. I don't know if you ever heard of Trichomonas before, but it is a sexually transmitted infection. And Trick actually lives, again, on the shafts of the male's penis. It lives there. Like that's their normal flora. Like it's okay to them. So males will never have Trick ever, but they can transmit it to women or females because it's not a part of our normal flora. So again, anybody can have a STD or STI, and you not know it. So, but women are more at risk and more prone to getting sexually transmitted infections and diseases. So just be, again, super careful. I know this topic is sometimes very, very sensitive, but it is very important to talk about as well. Okay.
Also, they got these super diseases now, like STDs be freaking me out because it seems like they come out with a couple of new ones every couple of years. And now they have like super gonorrhea. And I was like, what is that? And they were
Uncurable.
saying like it's like gonorrhea, but you can't get rid of it.
It's uncurable. Yeah. Mm-hmm.
So, is there anything else like that? Because I know, like in college, I worked in the relationship sexual violence prevention center. So, like,
Mm-hmm.
they had pamphlets and stuff for all this type of stuff. And that's the only reason I knew about it. But like people who don't go into these centers and like talk to people, they don't know about things like this. So, like,
Yeah.
are there STDs like that?
Well, this kind of leads into like the next slide that I have. So if you're ever worried about like STDs, so what's gonna happen is like, because I said they're so common, so many people, like truly almost 10 million people a day are diagnosed with an STD or STI. So, but what's happening now is like certain myths around, these particular diseases or these particular infections. And so it is some that is incurable, and it is some that you can get rid of with antibiotics. And that's what classifies the disease versus the infection. So again, young people between the ages of 15 and 25 have a higher chance of getting a STD and a STI. So sorry to tell you, Melanie girl, I know you're 15. just, we gonna play it safe, okay? We gonna practice good,
Okay,
safe.
we're gonna get through them 10 years.
We gonna practice good, safe, everything, okay? But it's common for girls to have a higher chance of getting an STD and STI. Some of the most common STIs are gonorrhea and chlamydia, and we call them the infections, obviously, because they can be cured with antibiotics. Another one that is really common that I didn't put on was the Trichomonas, which is what I said. A lot of girls get something called BV, which is bacterial vaginosis. Again, the male penis could be dirty and it's entering your vagina. That's just one way of getting it. And but that can also be cleared with the antibiotics as well. Now you have some that are not so curable, which is your STDs. So I'm sure you've heard of HIV. That can lead to obviously AIDS. Then you have HPV, which is the human papillomavirus, which is what girls who males can pass it on to females. Again, one of those things that lives with the male, and it can pass on to the female. But HPV, if left untreated, can cause cervical cancer. So that's one of those things that you obviously don't want that to turn into. And then another one that's incurable is herpes. So herpes simplex virus 2. Well, one is incurable too, but most adults or most people in general lives with herpes simplex virus 1. So that's like your common cold sore. So say when you get a cold or something and you see people with cold sores on their lips, that's what herpes simplex virus 1 is. It could have been passed through birth. It could have been passed through when you were a baby and somebody kissed you or something. That's how you got the herpes 1. But the herpes 2 is what's transmitted via sexually, and it's incurable. There's no cure for that disease. So you want to be very, very careful. I've heard that it's very, very painful. And again, we see girls come into the hospital all the time with HIV, with herpes, with things that they can't get rid of, and they're so young, truly as young as, this one says 15, but I've seen, again, as young as 9. So you just have to be very, very careful, okay? And then if you do not get it treated, you can have serious, serious health problems in the long run. And then this goes back to when I say, like, most people think that once they get an STD or STI, they think that they're dirty. I'm here to debunk that myth. That's not true. You're not dirty. You're not a bad person. It happens to the best of everyone, again, because it's so common and so rare. Again, you're amongst the millions of people who just get an infection. That's like if you had an ear infection, or if you had like strep throat or something like that. You're just amongst those million people who get infection. It was just it just happened to be, it was sexually transmitted. Again, it's not a bad thing. You're not a bad person. You just have to go get it treated. Again, this last thing that I put on there, and I put it in big bold like letters, is get tested. This is very, very, very important, because if you are sexually active, I hear a lot of teenagers come in and say, oh, he doesn't look like he have an STD, or she doesn't look like she have anything. So that means that what? They're going to go sleep with this person, or they're going to go, kiss with this person, or whatever the case may be. But you can't look at a person and tell if they have an STD or not. You can't, like, it doesn't just like live on your outside appearance or anything like that. Most people live very asymptomatic, meaning they have no symptoms. They don't feel anything. They don't even know they have a disease or infection until they get tested. So that's why it's very important that you get tested. And also, don't be that girl if I don't know if you're sexually active or not, but when you do start to become sexually active, just be smart about it. Don't let these boys tell you, oh, I don't have anything. No, ask. This goes back to protecting yourself and protecting your health. Hey, did you get tested? Hey, I take my feminine health very important. I need to know if you're tested. If we're gonna do this, you be safe. You know, just be smart about it, be safe about it, and ask the right question for sure.
Always use condoms, you know.
And always use condoms. That's what I'm gonna go to next. But yes, for sure. And then, in which we're almost done here. So it's my next one. So pregnancy. So I said, like, having sex, obviously, your sexual health, it's important to us, but it can lead to pregnancy as well. Now, it could be planned and unplanned. Now, most women, obviously older, 20s, close to 30s, they try to do planned pregnancies because then they're at a different stage of their life, right? But teenage pregnancies they tend to be more unplanned. Those are the ones that were the mistakes and oops, it happened. I didn't mean for it to happen. So if you're having sex, or if you are sexually active as a teenager, there's always a risk for pregnancy if you're having vaginal sex, of course. We know how pregnancy happens. It's obviously the semen or the cum, even pre-cum, because girls can get pregnant off of pre-cum as well. It gets into the vagina, or it doesn't even have to get into the actual vagina. You can actually get pregnant with like the semen that's around the vulva, like that's around the vagina opening. Anything, because semen travels. So anything that's around the opening canal and the semen there, you have a risk of getting pregnant. So again, if you're having sex, please use some form of birth control. So birth control is all encompassing of a lot of different things. It's not just the pill, okay? So birth control is condoms. Condoms, you have your male condoms and then you have your female condoms. And then you have the IUD, that's the implant that they put in for birth control. Then you have the pill, then you have the shot. It's so many different birth control methods. So if you are, sexually active and you are having sex and you do not want to get pregnant, again, this goes back to protecting yourself of using the condoms, making sure you are protected with some type of contraceptive, via birth control or anything like that, okay? However, the best way to avoid pregnancy and to avoid any STDs is called abstinence, okay? That is the absolute 100% foolproof way to not get pregnant and to not get an STD. And abstinence means don't have sex at all. Some people say don't have sex till marriage or whatever, but right now, abstinence is key, okay? That is very important, especially at the age of 15. Again, abstinence is very key, okay? We are focused on school and elevating.
I agree.
And not sex, okay? But that's very important. And then lastly, which we're going to wrap up here. So out of all the things that we talked about, this last slide is, oh no, something went wrong. Because again, we are human and mistakes do happen, right? So if something is going wrong, meaning if something is going wrong with your vaginal discharge, if you notice something is wrong with older, or something's not right with your, just feminine health in general or wellness in general, something's not right with your mental health, if something's not right with any type of illness that you feel like it's just abnormal to you, you don't feel good, just anything, you want to call your doctor, okay? You want to call your pediatrician, call your clinic, call the nurse, whoever it is that you seek medical attention from. If you have any questions or concerns, please give them a call, because the worst thing you can do is let something go unnoticed, and then you create a bigger issue than what it already was if it could have been treated, okay? Again, that goes for pregnancies, that goes for if you got pregnant and you waited. I know so many girls, I see so many young girls, they come in, they were pregnant, they were scared to tell their parents, or they were scared to, or whatever, the stigma behind being a teenage mom or whatever it is, they waited too late. And then now we can't give them the options of, termination or abortion, or we couldn't give them any resources to help them because they waited too late. Okay. So anything, you always want to do early prevention. Okay. If you notice anything abnormal. So like I said, the strong vaginal discharge or the odor, which is yellow or green, a change in your discharge, if you see a rash, a sore, a lesion, a painful anything, swelling in the vagina, you want to make sure that you seek medical attention. And anything that could be like just again abnormal to your health in general. So, and I'll give you a personal story. I wish I knew more of this information when I was in college. And you would think by the time you get to college, you would know a little more. Yeah, no, I waited late, and I had an allergy to latex, and I had no idea. And I was obviously nursing, like nursing school, so we wear latex gloves in the hospital, and I put them on, and I could not understand why I was like itching. Well, anywho, then I touched my vaginal area for what, I don't know why I touched myself, but I touched it, and it spread, the latex spread and everything was swollen. It was sore. I never said anything because one, I'm like, I was embarrassed. I didn't know why my vagina was swollen. I was embarrassed. I didn't want to go to the health department on our campus, nothing. And I didn't say anything, and I waited too late. And I almost went into anaphylactic shock because I had an allergic reaction and I had no idea. And truly the doctor was like, if you would have waited any later, you would have had a problem. And on top of that, I had a UTI. So I did not know. I couldn't understand why I was hurting while I was urinating, and my vagina was swollen. So just a personal, backstory. Do not wait. Go as early as you notice something is wrong with you. It's better to seek it out early and get it fixed before another problem presents itself. Okay. And that's pretty much the end of my presentation here. I know this is the end. That's pretty much the end of my presentation on like feminine health, just like a quick general overview. Do you have any questions at all, Melanie?
No, not now.